بسم الله.
اوكي خلاص. اعوذ بالله السميع العليم من الشيطان الرجيم. بسم الله الرحمن الرحيم، والصلاة والسلام على رسول الله. اللهم صل وسلم وبارك على محمد وعلى آله وصحبه والتابعين بإحسان إلى يوم الدين. We start in the name of Allah, the most gracious, most merciful. We bear witness there is no deity worthy worship except Allah. Praise and glory be to Him. And that Muhammad is the seal of messengers. He was sent as a mercy to all mankind. May peace and blessing of Allah be upon him, his family, his companions, and those who followed his path until the day of judgment. I greet you with the greeting of Islam. Assalamu alaikum wa rahmatullahi ta'ala wa barakatuh. Peace be upon you all, dear brothers, dear sisters, and dear viewers. This is Dr. Abdul Aziz with you on this Health Matters show. And we are very pleased to have our Dr. Brother Ahmed Hilmi. He's originally from Egypt, and of course he is in Britain here. And today we want to concentrate on the Health Matters show, but more or less focus on the case of Egypt, especially under the conditions of COVID-19 and of course health in general within the what we call the government sector and the private sector, and of course in between those non-governmental organizations where the charities are doing their work as well within this COVID-19 atmosphere. Let's start, inshallah, by introducing our brother Dr. Ahmed Hilmi. He's actually a specialist in diabetes as well. He will introduce himself as well. And inshallah. Assalamu alaikum wa rahmatullahi ta'ala wa barakatuh.
Alaikum assalam wa rahmatullahi wa barakatuh. Peace be upon you.
Welcome to our show. Jazakallah khair, brother Ahmed Hilmi, for being our guest today on this Health Matters show on this Radio Hajj, inshallah. And we want to talk about the situation, and please give us just a small introduction about yourself. What is your specialism? And of course, and then an introduction generally about health as well.
Assalamu alaikum wa rahmatullahi wa barakatuh. Peace be upon you all. In the name of Allah, the most compassionate, the most merciful. Jazakallah khair. Barakallah feek, Dr. Abdul Aziz, for this kind invitation. And welcome to all those who are following your excellent sort of initiative of getting the Radio Hajj and the Health Matters. Definitely raising awareness is one of the messages behind, the key message behind your show. So I welcome that. My name is Ahmed Hilmi, and I'm a consultant physician in the University Hospital of Birmingham, in Birmingham. My specialty is in medicine, diabetes, and endocrinology, study of hormones, and also I'm clinical lead for the weight management service in the trust where I work. My background is I'm originally from Egypt. I had my medical degree from Alexandria, from Egypt, years ago, a master's degree from the same university in Alexandria. Then I came to this country many years ago, and I had I'm fellow of the Royal College of Physicians of Ireland and also of Britain, Glasgow, and also I've done a master's degree in clinical education. I have interest in clinical education, and an honorary clinical lecturer, senior clinical lecturer in the University of Birmingham. On the Islamic side, alhamdulillah, I have a postgraduate diploma in Islamic studies from the Higher Institute of Islamic Studies in Egypt. And I've been a member of multiple medical and Islamic organizations in the country. We try to do a public and voluntary work as much as we can to try to raise awareness for the common good of the community, obviously. So that's the little introduction about what I'm. Also, I'm originally, as Brother Abdul Aziz mentioned, originally from Egypt. So I'm interested in the Egyptian issues, especially after the decade ago, the Arab Spring, and if you like, the dream to have democracy and to have, a dignity for our people back home in Egypt. Obviously, the COVID-19 has been a pandemic that affected the whole world for more than a year now, year and a half, maybe. This is the second year with this pandemic. And I'm sure this has an impact on different levels in back home in Egypt, and obviously all over the globe. Speaking specifically about Egypt, obviously I have to say maybe a few starting points. I'm saying that the system, or the health system in Egypt, had been in a gradual decline since the first coup in 1952. And then over the decades, over the Nasser period, then Sadat period, then Mubarak period, and then it came to the peak really during the last 7 years since the military coup in 2013. Another point to start with as well, to say that the mashallah, the Egyptian doctors and are eminent in different fields, whether in the country itself or actually all over the globe. We have a lot of expatriate Egyptians who have been excellent within the field of medicine in different places, professors and experts, not only in medicine, but in multiple fields. And this means that if you have a good system around you, you have a very good resources. But unfortunately, because the system is declining in Egypt, a lot of people have left the country and have been shown that they are eminent in different places all over the globe. One more thing, that's the corruption on the level of political levels and the economical level has an impact definitely on the health system. So definitely the corruption and lack, we have excellent resources. In terms of numbers, we have more than 100 million in terms of population. So you have human resources. You do have actually, people think that Egypt is a poor country. Egypt is not a poor country. Egypt has a lot of resources, but unfortunately over the years, there have been a lot of corruption from the non-elected political leaders or military, especially the military coup, the recent one of the last 7 years, with the exception, obviously, of the time of President Morsi, who was the first ever elected, democratically elected president, and this was in 2012. So until the military coup on the 3rd of July, 2013. Obviously, after the great Egyptian revolution on the 25th of January, 2011, that everybody followed in Tahrir Square, etc. So that's a bit of introduction about what's going on. And definitely there is a lot of details in relation to the COVID-19 problem over the last year and how the military coup has dealt
when you said about this corruption and the public sector has been affected badly. Now, comparing the public sector, which is the, say, between inverted National Health Service and the private sector, okay, in between we'll talk about the NGOs, non-governmental. Now, regarding the public sector, you said that it has been decaying with time as well, because a lot of the resources should be given to the health service is not going to the health service, is going for other things, for security and all these kind of things. And therefore, a lot of the social services are not supported as such, and with time, the decay is there. What about the private sector?
Absolutely. I think the very important question, Dr. Abdul Aziz, if I give you some numbers, for example, let's say the budget of the of the health system in Egypt is 1.2% of the budget. 1.2%. Only 1.2%. If you compare it with the UK, for example, which is 8.5%, you see the difference. Even the store or the constitution in Egypt, the one even from the coup in 2014, was actually agreed about 3%. So, but actually, the 1.2% only is used from the annual budget for health. And as you said, most of the resources have been taken for a military or just to oppose political opponents, etc., and also for things which as corruption for people who are within the junta of the military coup and then surroundings. Those people need to have money in order to continue to be support this illegitimate sort of system. In terms of the question specifically about the private sector, I can give you a little example. The number of hospitals, for example, in Egypt is, according to the 2018 statistics, is about 1,848 hospitals. 37.4% only, which is 691 hospitals, are governmental hospitals, while the 62.6%, which is the bulk or the main bulk, which is 1,157 hospitals, are private hospitals. So you see that a lot of work is done within the private, outside with the governmental arena, because people can't wouldn't trust and wouldn't get the proper service within the governmental hospitals. And definitely the private sector is also, it's a private sector, so it's really quite, you have to pay for it. So basically the taxpayers, actually people are paying a lot. The Sanduq Tahya Misr, they call it the pot for for Egypt, which has been invented by the military coup regime. people put money in that, and they think nobody can, no accountability. You don't know how much in this pot. In addition to that, the military coup themselves and the Sisi himself, they mentioned that they got a huge amount of billions from the Gulf areas for different reasons, basically to support this regime against the previously trial for democracy. And we don't know where this money is gone. I mean, there is no accountability. So basically, this is those statistics, by the way, is from the جهاز المركزي للتعبئة والإحصاء, the central body for national statistics office, if you like, in Egypt. So those are official figures. Imagine that with the lack of transparency and trust, even this is what have been declared. It obviously shows how the problem is so big in terms of getting the service on the level of the budget, so very minimal budget for the health sector, to in the governmental sort of service is quite minimal, or it's not the main bulk. So it's left for the private sector to try to do things, and the private sector, as you know, is a private sector. It's money, you have to pay for it. This is definitely
going for profit.
Definitely different from the national health
service.
There's
no such as a free health service.
No, there is none really. There is something called أهمية, الصحي, national security, which
insurance, yes.
Insurance, sorry, the national insurance, which is actually quite minimal. It's not covering the whole population by any chance. It's not like the national health service.
Okay, and about the NGOs, non-governmental organization or charitable, do you have any charitable hospitals?
We used to have actually a lot of those, but unfortunately, after the military coup, we used to have, like, for example, الجمعية الطبية الإسلامية, the medical Islamic society, which was actually having multiple branches all over the country to try to give the service in a reasonable price, and it used to be attached to masjids or worship places, etc., or in just public spaces to try to accommodate people who can't really afford the very expensive private hospitals, and also who can't they can't benefit from the service, governmental service, which doesn't give really a high standard of care because there is lack of resources, especially financial, due to the corruption. So unfortunately, this is, you would imagine that after the military coup, all those branches of this society, the Islamic society, medical society, have been confiscated and been taken by the military coup, and they claim all those are related to the opposition and stuff like that. So you don't have any say in any of those public organizations. They've been really killing, if you like. All those organizations have been, whether political, whether on the human rights organizations, whether it's for public service, very little. Everything needs to, the military wants everything to be in the hands of the army. The army itself, as you know, it's just it's a business. It's becoming business, doing all the goods and stuff like that, leaving the main role of being military to defend the country, to doing all the sort of business, taking roads and bridges and all the infrastructure. All is done by the military. Also, the mayors of the different cities are always retired generals and similar. So they really in sports, in everything. So they've been there because all those are the alliance of the current military junta, I'm afraid.
Okay. And about now, what is the health of the nation? Diseases. I know the late Abdul Aziz used to concentrate on the Alzheimer's disease and all this kind of thing. And therefore, that is the health of the nation, and what are the diseases common besides COVID-19 and before COVID-19 anyway?
There is a historical disease called schistosomiasis or bilharziasis, which is an endemic related to some snails in the Nile River, and this caused a lot of problems related to chronic liver diseases and etc. This was something endemic for over the years. And then the hepatitis C, I think, was one of those big issues before the COVID. It used to be a big, and some medical professionals link the bilharziasis with the hepatitis C to some extent in a way. It's not 100% confirmed, but there might be a link between the two. So those were big problems. in addition to multiple health problems in terms of obesity, for example, in my field, in diabetes. We're speaking about, increase in the wave of obesity and in the country. And we know that obesity is a risk factor for multiple chronic illnesses like diabetes, hypertension, and chronic illnesses. So those have been like emerging, and with the lack of public health and preventive medicine, if you like, so people in terms of prevention, this have been lacking, because people have been really trying to get the basic stuff for their life, because they wouldn't afford the basic stuff. The military coup with the corruption came and just puts maybe 50% of the people under the level of the level of standard of, and so poverty is quite extensive there, because not because as I said, the country is poor, but because there is a big corruption in there. So, and you can we can speak about that in terms of the doctors, for example. So, yes. for example, if we speak about the doctors, we know that you'd be surprised that the salary of the new doctor who's just graduated, yes. It would be about $190 per month, which is around 2,000, about 3,000 Egyptian pounds. It's quite comic, really. So $190 per month, and this can increase gradually, but definitely doesn't come to the standard of to secure the normal dignified life for doctors. That's why we wouldn't be surprised if I can tell you that there's been a lot of immigration,
yes, exodus,
of doctors. Yeah. Absolutely. So the doctors, we know that the registered doctors in Egypt, for example, in 2019 were about 100,013 and 100 doctors, and then about I'll tell you exactly. I have the numbers. There have been a lot of immigration for the doctors, and we're speaking about. Let me just find for you the numbers. I'll find it for you anyway, because I did prepare it. But
as I said, yes,
in due course,
the big number have left Egypt.
They left the country. They left the country.
And usually, where do they go? They go to Arab countries? Do they go to Europe? Do they go to America? Where do they go?
There have been an initial rush in the 90s to the Gulf countries, and then after that, it started to become very obvious that people start to go to Europe as well. I would say even here in the UK. So we said that the statistics here in front of me here, it says 62% of the Egyptian doctors are outside the country. Outside the country. So yeah, 62%. These were again like official statistics in 2019. So this is one of those catastrophic numbers or percentages of doctors leaving the country. For different reasons, for financial reasons, obviously, for after the military coup, I'm afraid for security reasons. Yeah, any doctor who just speak against even speaking about the failure of the system related to COVID. People put something on the social media. They've been caught and they've been they disappear. Basically, they disappear. What's called اختفاء القسري. People don't know where they've gone. And this is a terrible sort of situation when people find themselves even speaking, reflecting what's happening in the hospitals on social media. They disappear and we don't know where they go. And so far, the Egyptian syndicate, نقابة الأطباء, had declared nearly approaching 400 doctors who passed away during the COVID time.
This is on the health service, 400 people.
Approaching 400, 390 plus.
Due to COVID-19.
Egyptian doctors due to COVID-19 during just the last year.
Right.
Obviously, due to the lack of the PPE, the personal protective equipment for people who are facing are the front line, if you like, doctors. Initially, the cover by the governments, the military coup, they were actually praising doctors initially, called the Jaish al-Abyad, the White Army. They've been praised in the media. Then when they started to speak about, that's the situation, please, we need the PPE, we need cover, we need protection, we need financial support to face the problem. There have been lack of oxygen in some hospitals. They have been actually, obviously, now they're not anymore. They are the one who leave the Maidan, they leave the scene. they're unethical. They're being given all sorts of characters. That those doctors are leaving the battle, if as it were, while they're not. They are actually trying to face
any because in Muslim, sometimes I follow a world meter about COVID-19 in different countries.
Yes.
And usually it's very hard to get accurate statistic from the Muslim world in general, the Arab world, the third world countries between inverted commas. But in Egypt, do we have any indication about, the number of infected people, the number who have recovered, the number of deaths? Vaccination, has it started or hasn't never started before?
The problem is the lack of transparency here in the numbers. So you can't, to be honest, believe the numbers. For example, in Egypt, if you go to the Corona world meter now, you can open it with me now.
Yes. Yeah.
If you go to the simple thing, which is the numbers of tests, of Corona tests, it's been static around 1 million for many weeks. There is no updates. Every day you find updates. So if you go for the UK, for example,
or
which
United
is
States.
Any of those,
on daily basis.
On daily basis. The numbers, definitely we can't trust those numbers. And Egypt's now the number 66 in the Corona world meter, with a population of 133 million population, more than 100 million. So it wouldn't really, you might argue and say, there's been like good effort done or something like that, but we don't have any evidence of that either. And we had a lot of criticism from the WHO, the regional office, even from very eminent sort of New York Times, for example. The correspondent of New York Times have been there, and he did write about the catastrophe that the Sisi and the military coup are facing, and he has been asked to leave the country. As simple as that. So this, if he gives any message, send a message that the military coup, they don't want to get, they won't have transparency. They don't want it. There is no political will to do it, and even they don't have to be honest, the capability of doing it as well.
Therefore, even the Office of National Statistics is not independent. It's a governmental organization. It's not an NGO like we have the ONS here. The Office of National Statistics in UK is independent from the government, and therefore they will be independently gathering data and putting it up to the public.
Even if it's something is related to the government, there should be accountability. For example, here we know that the decision made by the government, there is accountability in the parliaments all time, and even on the British Medical Journal, we have every other edition, we have people just speaking about what's happening. And so, for example, have a look to this one, for example, on the cover of British Medical Journal the other day. So it says when. Obviously, now the numbers are more than this.
More than that.
Saying what they say on the top, what went wrong. They want to actually speak to this is a medical journal that's, if you have somebody putting on the social media something like that back home, I mean, whoever has a magazine like this, he wouldn't be at home in the following morning. Because here they're saying to the country, this is the number of deaths. What went wrong? We need accountability. We need tell us what's the answers.
So, and are you saying that, like here when we started, is decision about, lockdown and everything, is it on a clinical base or political or economical? And I think in Egypt, I think clinical is not part of this equation.
As I said before, we do have excellent experts in different fields. Unfortunately, because the system was corrupted and was not to the level after many years with little budgets, people who are really expert left the country, as I said. The other thing, that those people who are leading the service now are all either generals, retired generals, or military. People who really want to please the governments. So we did have, I don't know, I think he passed away, somebody called General, what was his name? Someone who just, he was not actually, I think he was a paramedic, and he became a general by the
general,
Abdul Ati. He used to be Abdul Ati. Even the jokes, Abdul Ati Kufta and stuff, he used to say about inventing devices and inventing this.
And do you have any data in front of you about what is the COVID situation now, for example?
Unfortunately, we wouldn't be able to access that even in the WHO level. They wouldn't really say. The Corona World Meters tell you the numbers. The number are quite, I would say, no one can believe probably those official numbers declared. The official numbers declared now say that we do have currently 185,000 people have been affected by the disease. And those who died, about 10,000. Who can believe that just 10,000
out of 100 million?
Yeah, about 100 million. And the test, as I said, we don't have tests. So how we know that they have the disease? The other thing, which is the corruption in writing the death certificate, which is another ethical thing as well. So are we able
cause of death
to rely? Yeah, absolutely, because you can't rely on this if you don't have a proper diagnosis. You wouldn't have the proper sort of cause of death on the proper death certificates. You wouldn't be able to tell us exactly how many people died really from the disease or not. So those are all question marks that have been raised in terms of transparency about the numbers. So there is no way, to be honest, to know the exact number.
And without data, therefore, we do not know about the seriousness and the emergency of the situation.
Because people would have died, and they wouldn't really know that they have the disease because they haven't been tested for it, because it's not accessible, not available. The other thing is the as I said, the death certificate itself, or how we can be able to get the statistics. And there is no political will to actually try to do that. Always the military junta will say that we are the military, we're doing this, we're doing that. So why, for example, here, I know it didn't work 100%. The field hospitals, the Nightingale Hospital in London, and the similar one in Birmingham.
Yeah.
At least there is a political will. We need to get an extensive hospital sort of setting for an emergency situation. Unfortunately, this was not the priority for the government. The government is doing like العاصمة الإدارية الجديدة, a new capital in the middle of the desert for really for highly ranked people, and also doing like a fast track train or something like that. Definitely, I would have loved for my country to have all the excellent infrastructure and all this, but is this the priority now? And we know that's the قصور الرئاسية, the palaces of the Sisi himself. I mean, he was criticized by one of the businessmen who used to work for him. His name is Muhammad Ali. I think people have been following him last year or a couple of years. And he actually mentioned a lot of things from the within. And then the Sisi, his point was say, yes, we do. I'm just spending a lot on those, presidential palaces, and I will continue to spend more on them. So this was really
and
foreign
aid. The foreign aid which the Egypt received from United States, from the Gulf states, and all these kind of things, where does it go?
This is a big question to be passed to this military junta. This is a big question to be asked to them. I have some, as I told you, the statistics. I found it now. The مركز المصري للدراسات الاقتصادية. It's non-governmental, so the Egyptian Center for the Political Studies, and they did. They mentioned during the last year of the Corona, 7,000 doctors have left the country in 2020, and so this is quite a big number. And also, I was curious to look to what they call the people who are coming here to the UK. I looked to what they call the PLAB test. People who come from Egypt or other countries, or any country outside the EU, they need to pass an exam to make an equivalent exam.
Yes,
it's called the PLAB test, which is the Professional Linguistic Assessment Board test. And obviously, the numbers have been increasing gradually, even before the COVID, from 3,000 plus doctors in 2016 to 11,000 doctors in 2019. There have been obviously a drop because the exams was put on hold. But I looked to the countries that's really where the doctors are coming from. And I found that the top were the following: Nigeria was number one, Pakistan, India, then Egypt. So Egypt was the top Arab country, if you like, where doctors are coming from the Arab world to come to the UK to pass this test. And obviously, it's for obvious reasons as well that the number of the population is huge in Nigeria. It's about 206 million. In Pakistan, it's about 220 million. In India, it's about 1 billion. In Egypt, we have 100 million. So the key home message here is that Egyptian doctors come the top for the PLAB test here in the UK from the Arab countries. This means that those 7,000 doctors are seeking, medical career in outside the country, and including the UK as well. And we see that in our hospitals. I have a lot of, friends or friends of friends asking to do clinical attachment. They want to get jobs here and asking me because they've been here and my colleagues have been here for a long time. They want to come. So we feel that even on a personal level as well. So definitely it's quite a big story that people leave the country during this time because they find themselves really not only at risk, they can't work. They really can't. They don't get.
And know about prevention is better than cure. There was any strategy regarding here, the government was changing as the situation gets serious. The lockdown, the tiers system. They put, and then they came to a conclusion. We don't rely on dates. We rely on data and everything. Therefore, scientists and the SAGE committee were independent scientific people who are specialists who advise the government what to do. And at the end of the day, the British government came to their senses and moved from their political, economical, whatever pretexts to actually clinical, and therefore it was serious. The nation was under danger. And once we hit more than 100,000 people who have died from this COVID-19, the government changed its policy. Now, how the government, between inverted commas, in this setup, what you are talked about Egypt, and of course, under the military rule and everything, and emergency rule as well, have they set up any strategy to prevent COVID-19 spreading and killing more people?
Obviously, if you open the website of the Ministry of Health, which is of the military coup, you will find a lot of very, very nice sort of things about things happening, etc., which is definitely they're not existing on the ground, and the evidence of that, people, as I said, leaving the country and speaking to people who are in the front line. We know for sure that there have been no real strategy for that, and we know quite well that the only source of information will be from the Minister of Health in Egypt.
Yes.
Yeah, the health minister. Even the Egyptian syndicate, which was meant to be Niqabat al-Atibba, which is meant to be, if you like an association that represents, it's non-governmental and it's represent the doctors. I'll give you a very, very simple example. We know Dr. Aissam Al-Aryan. He was one of the eminent doctors in Egypt, and he was also a political opponent. So obviously, he was one of the very famous names.
He
passed away. The Egyptian syndicate just puts like condolences, say this was, and he was actually an eminent one in the syndicate because he was elected by the doctors. There been a pressure on the Egyptian syndicate to take this condolences letter back again. They put the condolences letter for someone who passed away, and pressure from the government say, how come that you do that?
This is what
to
is
that
degree
extent.
of
So
intolerance.
To that extent. So even someone who passed away just because he was a political opponent, trying to get all his history and all his what he's done to the country, just because of this. Revenge for a political opponent to that extent. So how come that this government will listen to the Egyptian syndicate just to try to give advice on the advice on the medical level, on facing coronavirus, etc. So definitely, as you mentioned, there is a huge corruption there. There is no political willingness to get things done. Not only that, there have been some ironic stuff that, for example, Egypt have been exporting PPE at the beginning last year in early 2020. People did export the PPE, the face masks and the PPE to Italy and to the States. So Egypt's meant to take, an annual sort of aid, financial aid from the States, and at the same time, they are actually exporting in a show and in sort of media show that we are exporting this to Italy. Obviously, we know that Italy specifically, there have been an issue related to Giulio Regeni, the young man academic who was just assassinated in Egypt. A lot of people know about that from human rights perspective. Was the Egyptian sort of military coup government trying to get some sort of putting that in a way just as part of this open sort of problem, we don't know. But obviously you lack PPE, and at the same time you export the PPE. Very ironic, to be honest, attitude of this government, and give you a clue with little things. I'm just telling you how this government is behaving. There have been some curfew at some points, but at the end of the day, is the media message was saying Masr al-Mahrusa, Egypt is protected, trying to use the some sort of those terminologies that we're doing a great job. The world is surprised. The world is surprised what Egypt is doing to face the virus, because there is no free speech, there is no free media in there, and I think people are quite aware about that.
And the message, the communication between the government or whatever who is in charge, go to the actual public domain and people listen to these messages, or there is mistrust as usual from whatever is said by the government to anybody in position of leadership? Obviously,
the Egypt now, it's after the revolution in 2011, people are quite different. As you know, people got together to get rid of Mubarak. They got rid of the top of the system, if you like, but the system itself came back again in a worse situation, or in a super worse situation. So people are quite aware. In the old days, used to be like one voice, the government, but with the social media, in the modern era, people know quite well what's going on, and people, they might be, if you like, obliged to not to speak, because obviously anyone who speaks loud will disappear or get tortures or get behind bars. We know that we don't know the exact numbers, but at least there is about 60,000 political prisoners in Egypt until we speak now. Many from different, for all the varieties of political.
It's a good point you mentioned about the 60 or so, I think 100,000 or so who are in prison. The number we don't know. The situation in prison, a lot of human rights organizations have highlighted that the condition of imprisonment is very bad, especially about health, and especially under the COVID-19. Now, I think we hear from now and then some prisoners who die. I think Isam al-Aryan, Allah has mercy upon him, died while he was in detention in the prison as well, and from medical reasons as well, like before him, Muhammad Morsi, and a lot of other people as well. Now, do we have any human rights organization or NGOs, non-government organizations, who have been able to go and check the condition in which those prisoners are held?
Obviously, if we say there is a lack of transparency for the public domain, so you would imagine if we have this the lack of transparency, it will be more eminent within people behind bars, which is difficult to get. Apart from people who just basically who were in prison and left, like Muhammad Sultan, for example, a very famous name in the States now. We knew what's been going on. In addition to that, during the times of muhakamat, during the time of the trials, which is comic trials, we saw Dr. Morsi in a cage. We can't listen to his voice. We can't. This was public, and subhanallah, they were actually. It was a scandal, if you like. He was a symbol, and he died himself because he was, was not given any medical attention. He was diabetic. He did have this. And you mentioned Dr. Isam al-Aryan and many hundreds of others, maybe because those are public figures. They were known. Many people who are really were activists, but maybe not as public, or the names are. They do die, and then we know the stories. We definitely have a lot of reports and a lot of from the Human Rights Watch and Amnesty International, etc. We can refer to that. I'm not an expert in this field, but we can definitely, we are interested in the Sha'n al-Am, or the public domain. We have gone through all those, and definitely whatever information is available tells us that those people are suffering. People are in very bad conditions. They can't meet their relatives. They can't have a lawyer or a solicitor to come to speak on their behalf. People are left for many months in very small and very bad conditions.
And years as well, and without a conviction or without just...
Absolutely. And you would imagine people like a small room with plenty of people. We're speaking about social distancing. How come that you can get the social distancing within that? So definitely there is a big catastrophe happening behind bars. And there have been a lot of human rights organizations, non-governmental, in the reports, especially in the outside the country, who are trying to monitor cases who have been either from families who can speak, without mentioning the names, or people who have been escaped, fled the country and went out and just started to speak loud, etc. So we got those stories, and unfortunately we know quite well that there is no single voice can speak, against the current regime, even from those who are aligned to this regime in the so-called 30th of June, or just before the military coup. Nobody was able to get any part of the kahka or part of the cake. Nobody was able to get that. Everybody was just thrown away, including Harakat Sitta Abril. None, whether they are from Muslim background or Islamic background, like Muslim Brotherhood, or like the 6th of April movement. Everybody, even those who were used to do, like Bassem Youssef, those who used to be part of the regime at the time, trying to give a bad media portrayal of Morsi, and said they couldn't. Ala al-Aswani, all people who were even opposition, they are living outside because they can't speak in, they can't say anything.
Therefore, you are talking prisoners are held in what we call it like a slow death because of the lack of health care and all this kind of thing. And sometimes
I think from your platform, from your respected platform, I think it's we need to send a big message to try to get the free people over the globe to support those people behind the bars.
There's actually a petition which has been put up regarding the amnesty, general amnesty, like other people have done it in other countries as well, to release those, especially political prisoners. And as you know, most of them are over their 60s years old and everything, therefore, and most of them have underlying health condition as well. And there is actually a petition going around talking about general amnesty. Even the Foreign Office from United Kingdom here they have actually produced a report, a health and a human rights report about, and Amnesty International have done one, and a lot of human rights organizations. But why the outside the world, especially one of the backers as the United States, do you think that with the Biden administration we may see different policies applied, and maybe those human rights abuse will be stopping in Egypt and releasing those political prisoners from jail?
I think that is while we speak about the freedom of speech in the West and in the international community, etc., in many countries, and we do appreciate that, but at the same time there is a big moral and ethical criticism of for example, the UK government and the US government of shaking hands with this CC4. We know well that it's related to more. They are aware of those violations of human rights, but they do have interests in the region. And unfortunately, the interests sometimes override the values. And this has been a continuous criticism of those governments, not to shake hands with such a system coming with the military coup in the 21st century, violating the human rights in the country, doing all sorts of political corruptions, etc. So I think from your platform, again, I think we send a clear message to the United Nations, to the US, to the UK government, European governments.
Union.
Absolutely. Just to say that this needs to stop. This support for the Sisi and similar regimes for the sake of just interest is really unacceptable. And it should be, if we're speaking about values of freedom and etc. and democracy, it shouldn't be only for Western countries, but needs to be promoted within, all the world. It should be universal values, not only for some countries and not for the others.
And I believe as well which you are talking about. Usually there is a big problem within those countries, like a case of Egypt, between the executive, which is the legislator, and the executive government and military and security, and the population or the civil society as a whole. And the problem is this trust and mistrust between the two. A lot of those Western organizations, Western European and the United States, everything, they sort this out when they introduced and they empowered the what we call the civil society by organizing it under the non-governmental organization, and those sectors like health, education, a lot of things, information, all these kind of things became a public domain, and most of them were run by what we call non-governmental agencies who control the actual standards of those like health establishment, hospitals, and like you see here, most of the health in UK health hospitals are endowments, are charities or charitable foundations, and they are independent, and of course they don't get involved in the nitty-gritty of politics which change from one day to day, but they get on with the real job of looking after the health of the nation. But do you think that the civil society in Egypt is not as organized, or the laws and legislation doesn't allow it to organize itself and to have a very positive role to play in looking after those, sector like education, health, and other things as well?
Let me tell you the bottom line. As long as this military coup is surviving, is still there, exists, you can't speak about any human rights. You can't speak about any non-governmental organizations in real life. They might be part of the regime. I think that's why the revolution came to the Arab Spring in general, and all it was not a revolution of food. Yes, part of it was عيش, حرية, عدالة اجتماعية, كرامة إنسانية. Yes, there was an economic component in it because people were really under pressure from that. But it was mainly to امتلاك الإرادة, to get their say, to get the democracy, to get the dignity back. So they wanted freedom, really, to be able to get a democracy when they can really choose who to be the leaders who govern the country. Now, in the absence of this is the key message. As long as this absence of freedom and having somebody, a military controlling the country, and stopping all free speech, controlling the media, controlling everything, I don't think there will be a real free life or non-governmental life to work outside the sphere or the control, if you like, of this military coup, which is trying by all means, because they know they are illegitimate. They haven't been elected. They're fake elections, if you like, after the coup. They're trying to persist, to keep their existence as much as they can with the support of the other international community or international countries, if you like, Western countries, because of the interest. Because as long as he stays, he keeps those interests running. So I think it's a difficult sort of equation. Having said that, I think the Egyptian people, I don't think they never lost hope, especially the young generations, those who actually lived real democracy for just only for 1 year, I'm afraid. And they created those photos in Tahrir Square can be replicated. Yes, people reach a level when they say, oh, how come? It's like, yes, or desperate. They shouldn't be. I mean, despite those looks quite dark and things are not really, there is no end to the tunnel. But I claim that people still in their heart, they have the same dreams still living in themselves. They want people in outside the country who can speak like what we're speaking now. We have the freedom of speech to say. People inside the country, even they can't express it because because of the fear and this dictatorship. They still have a potential, especially with the decline in the economic situation in all spheres of life, on the social level, on the health side, the COVID-19, etc. I think it should be a cumulative effect. We don't know when this will happen again. For example, we know
the motto which always was repeated, and it's repeated now.
It might be something very simple, like Abdul Aziz in Tunisia. Remember that it was people had the corruption for decades. Same in Egypt, and this became this Khalid Said. And then the inspiration from the Tunisian experience, a few weeks prior to the Egyptian revolution. So you can't tell, you can't sort of push a button and create a revolution. But definitely, it's a cumulative.
It's a process.
It's a process. It's a cumulative effect. And to be honest, I believe that in the Umr countries. I mean, yes, my life might be 60, 70. Our life as human beings might be whatever. Those people who survive 100 years. But the nations, the 10 years in the nation's age is nothing.
Yes.
Is nothing. It's a little very small stage, and we know for sure that people, even in the UK and other countries, in France, etc., they struggled for many centuries to try to get to actually to claim the democracy, to claim a good system that respect the human beings and etc. to get this democracy. And I claim and I think that the Egyptian people and all the people in the region as well, it's a dream in their hearts and their minds, and they lived it for a year, and I think they are insisting and they are persevering, and they're steadfast to get this happening again. When it can happen, obviously, we can't predict the date, but I think we never lose the hope, and I think at some point all the dictators disappeared, even they stayed for long. We have to learn from the history. We have to learn from the history.
The motto about no to military state, but yes to civil state. And now we just go back to there because we have just a few minutes left in my program. And the actual vaccination, anything happening?
The vaccination, obviously, there is a big problem related to the vaccine, because we heard about Chinese vaccine and some gifts coming from China, some gifts coming from the Emirates and Russia, etc. But to be honest, we know internationally, and I'm speaking here from medical background, we know that the robust research showed efficacy and safety for 3 main vaccines so far. Tens and hundreds even of vaccines and research are ongoing. But we know that the Food and Drug Administration, for example, in the States, and the MHRA, which is the medical and medicine and healthcare products regulatory agency here in the UK, and the European Medical Agency, EMA, in Europe, they approved Pfizer BioNTech vaccine, they approved Oxford AstraZeneca, and they approved Moderna vaccines. Plus or minus, there is Johnson is coming, and Novavax coming as well quite soon, because they're almost finishing phase 3 trials. The Chinese vaccines, we are scientific people here. We're not again. We know that China has a lot of issues related to human rights as well. But here we're speaking really on an ethical and purely medical point of view. We didn't have any publication or research to tell us for sure that there is safety of the either the Sinopharm or Sinovac. Maybe Sinopharm is a vaccine by a governmental company in China. The Sinovac is a private company doing it, and the trials for the Sinopharm have been done in Emirates and some South American countries, Brazil specifically, and the Sinovac has been done in Turkey and again in Brazil and some other South American countries. There is no robust data to tell us that it might work, but we don't have the data that give us, and the regulatory bodies that has approved those vaccines. We know that WHO even approved the Oxford vaccine, the Pfizer, the Moderna. And I think if any country in the region would love to get a vaccine to save and to protect their population, they would have gone for those vaccines. And if we speak about the Oxford AstraZeneca, they might say it's inexpensive. We are not very rich countries. But the Oxford AstraZeneca is a £3 per vaccine, while the Pfizer is £15 per dose, and the Moderna is £25. So it's a £3. It's quite cheap. It doesn't need freezing, just the normal fridge. So if those countries, in my opinion, are really keen for their populations, they would have easily lobbied for those companies. They're not charities. I mean, those companies they want benefits. They can do some charity work, they reduce their prices, but they are big companies. They need to get, they have shareholders, and they.
But as you said before, if the money Egypt is getting everything, and put it
why not? Why not?
Put it the expertise of the those people are consultant and very able people from Egyptian doctors and everything. They will be actually, I believe, in position to produce the vaccine.
They would have done that. Yeah, they would definitely. I think our countries need. That's why I think Mohammed Morsi, the president of Egypt, rahimahullah, peace be upon him, he said his dream was to get so that the Egypt can secure its food, secure its military sort of and weapons and military thing, and dawa, their medications.
Medication.
I think if he's not alive now, but his spirit he's inspiring to all the revolution and the generation and the coming generations. He wanted for the country to be able, as you said exactly, to produce their own vaccines, to produce their own medicines. Even though if we accept that maybe, yes, this needs a work, needs an effort, but at least if you want to, you export everything, do you? I mean, so I think why not to get a deal with those big companies to try to get the vaccine to your country? And why not to produce it? You said the military are sort of miraculous. They can do like they can do whatever. So why not to establish, like a pharmaceutical sort of a place when they can produce the vaccine locally, can get some sort of negotiation with the big companies, especially like Oxford, AstraZeneca, and get the vaccine done in Egypt. Just if you're really keen for the health of your population. Right. But I'm not against the Chinese vaccine, but I'm saying there is no robust data.
No,
we don't have
data about them.
Any data. There's some data, some work done, but it's not approved, if you like, by one of the eminent sort of regulatory bodies all over the globe to tell us that this is something that we could have gone for. And the other vaccine that's available. So why not the country hasn't done the government? Fortunately, they're not keen for the people. They want to keep their sort of illegitimacy. But as I said, Morsi and his soul, not only we're not speaking about Morsi on his own, but I think Morsi as a symbol, he's inspiring the revolution in Tahrir Square. We'll never forget those, and Egyptian people and the free people all over the globe like yourself and other people doing like similar sort of activities and initiatives. All those are cumulative. We keep sending the message across. We keep having this free voice sent to everyone on this earth. And I'm sure the free people all over the globe will continue to support the cause. And I think the history teaches us that even if the tyrants stay for long, دولة الباطل ساعة ودولة الحق إلى يوم الساعة. So if they stay for an hour, I mean the free establishment and the free sort of the willingness and the dignity of people and their will and their determination to get freedom and democracy will definitely be victorious.
All right, mashallah. Thank you very much, Brother Dr. Ahmed Hilmi, for your contribution on the Health Matters show. We just highlight the case of Egypt from revolution, Arab Spring, and then through the now military rule, and people are looking for civilian state as well and looking for democracy back to get on with the development of the country and putting the resources right where it should be on the health, education, and economic development and everything. Of course, Egypt is a very heavyweight state within the region and the world as well. And as you said it, the message of hope there, wherever there is a will, there is a will, there is inshallah, there will be a way out of that situation. And we pray to Allah subhanahu wa ta'ala to protect you as well, your family. Thank you very much for your contribution, inshallah. And maybe we'll get another program soon, inshallah, to have an update about the situation, and hope it will be getting better. With that, we finish our program.
Thanks so much for the invitation.
Thank you very much. Attention. We say subhanakallah bihamdik nashhadu wa astaghfiruka wa atubu ilayk. A'udhu billahi minash shaitanir rajim. Bismillahir rahmanir rahim. Wal 'asr inna al-insana lafi khusr illa alladhina amanu wa 'amilus salihat wa tawasaw bil haqqi wa tawasaw bis sabr wa jazakumullahu khair. Wassalamu alaykum wa rahmatullahi ta'ala wa barakatuh.
Assalamu alaykum wa rahmatullahi wa barakatuh.